Indigenous people, based on their cultural beliefs, they don't perceive disease the same way as we do. And it is often quite difficult to make the link of a group A streptococcal infection leading to heart disease.
The help's there from the health department. I think it's just about us as a people. Two people need to go regular checkups, and I reckon it's important that we're trying to stay healthy in communities. I think it's a bit of struggle, but the help's there. I think it's worked both ways. We've got to come into clinics and get ourselves checked out.
Trenton is an 8-year-old young boy with severe rheumatic heart disease. Trenton had his first episode of acute rheumatic fever at 7 years of age. At first presentation, he came in with sore joints and being really short of breath. He was started on some cardiac medications at the Royal Darwin Hospital, where he was hospitalised, and initially he had a really positive response to the treatment. And we were really optimistic that he would be able to avoid the need for cardiac surgery. He returned to his home community, Bathurst Island, and there very quickly he became more symptomatic. He was unable to lie flat. He was unable to walk around. He was short of breath just walking down on the street. He was withdrawing from his usual activities, and we were left with no choice but for him to have urgent cardiac surgery during the episode of acute rheumatic fever in Melbourne. Before his operation, he had an extremely dilated heart, and his cardiac function was already impaired. It was clear that he needed urgent cardiac surgery, and we couldn't wait for a few more months to hope for the inflammation to settle. Because of the very severe inflammation, the surgical repair was challenging. His operation went smoothly with no complications, but he was left with moderate mitral regurgitation. When he returned to Darwin, it was important for him to continue his medications, his cardiac medications, because his cardiac function was also compromised. So it sounds like you've been pretty happy with him, and he's completely back to his usual self. Would you say that? Yeah. Okay. And Trenton, I hear that you've been really good with your needles every month, every 4 weeks, so I'm really proud of you. I've just checked up on your records, and I see that you haven't missed any, that you got every single one of them on time, so very pleased with that. Yeah. Trenton has returned to full activities. He's able to play sports, he's able to go hunting, he has become very active, completely symptom-free.
If somebody has acute rheumatic fever, they need to have an ultrasound of their heart to see if their heart valves are damaged or if they're healthy. Then that person needs to go on penicillin injections every 3 to 4 weeks to prevent a further streptococcal infection, which could then trigger another episode of acute rheumatic fever, which could then cause heart valve damage or cause further heart valve damage. Even if the needle is given just a few days late, there may be a recurrence of acute rheumatic fever might follow.
So this is that's the door that was fixed just up here. Okay, so let's have a listen to your heart, Trenton. This is what your heart sounds like. Sounds alright? Yeah? This is what we call the 4-chamber view of the heart, where you can see all 4 chambers, the left ventricle, left atrium, right ventricle and right atrium. And this door here is called the mitral valve. In Trenton's case, it is the mitral valve that was repaired surgically in Melbourne. We put colour. You can see the direction of the blood flow. And then just the last thing we need to do is to have a look at this mitral valve that was fixed. And what we can see here, we can see that there's a little bit of regurgitation of the mitral valve, which is fantastic, because after the operation there was still quite significant regurgitation of this valve, and that looks much better today. It is critical for Trenton to continue living at his mother's place, because his mother understands the importance, and understands the importance of getting his injections, and even if Trenton puts up a fight, she still ensures that Trenton is taken to the clinic and that he gets his injection on time. Looking at things today, things have improved significantly compared with last time. So I think it's safe to stop his tablet now. So the only thing he needs is his needle.
Needle every month.
A needle every month, every 4 weeks, just like what you've been doing. I'm really happy for him to continue playing sports, hunting, all those things. In fact, we'd like him to be very active.
I think it's an important thing to stay healthier. If you get sore throat or a skin soreness, I reckon it's important to go to the clinic and get it treated, get it checked out, for your own sake, for your own good. And like I said, it's a big thing to stay healthy and get it checked out.